I'm Dr. Nichelle Haynes.
I'm Dr. Kristen Lassiter.
And we're Medical Mamas. This is your place to get evidence-based information about your reproductive mental health.
Meaning mental health in relation to reproductive hormone changes like around pregnancy, postpartum, menopause, premenstrual disorders, and infertility.
Today we're going to talk about hormone levels in the postpartum period and do you need to check them?
It'll be a great video.
Okay, talking about hormones in the postpartum period, I think it's nice to give a little bit of a baseline information about what happens during pregnancy and then in the immediate postpartum period.
Yeah, during pregnancy, your hormones, specifically your estrogen and progesterone, which you have different types of estrogen and progesterone, but they all skyrocket. So they're the highest than they will ever be in your lifetime when you're pregnant.
So progesterone specifically is for gest is like the medical thing for pregnancy, right? Gestation.
Yeah.
So it's for pregnancy, and so it helps keep you pregnant. So the first part of the pregnancy, the progesterone is made by the corpus luteum, which is part of where the egg came from.
It's made by their ovaries.
Right, yes. So during the next part of pregnancy is made by the placenta.
So once the placenta grows and establishes itself, then the placenta takes over making the progesterone and the estrogen.
So that's an important piece of information to have because after delivery of the baby becomes delivery of the placenta.
And there goes all your hormones.
Yep, it's gone. You basically go from the highest it will ever be, kind of like a graph, all the way up, and then delivery of the placenta, down.
Yeah.
So quickly.
The metabolism of those hormones, basically they go down within a day or two. They're at zilch.
It's really that change that can lead to problems.
So I think it's important to point out that hormones actually affect our brain. So we have receptors in our brain for both progesterone and estrogen, for different metabolites of them, and these receptors are located in parts of our brain that control behavior, control feelings, control memory, lots of different things. And so as our hormones are increasing or changing, those receptors are being signaled, and that's affecting how we're feeling, how we're behaving, the nesting, the being more emotional. All those things are totally normal, and estrogen and progesterone's way of helping you prepare for baby. But then when those go away, obviously that comes out of our brain too, so those receptors aren't getting triggered as much, and so that also creates this whole dysregulation of what's going on in our brain postpartum.
I know this example is not an accurate example, but I think everyone kind of understands this example. It's kind of like the frog in the boiling water, right? That I'm going somewhere. Okay, so related to the change is the big piece, right?
Okay.
So when you have a pot of water and you have a frog and you're cooking the frog or whatever, right? Maybe you've never heard this. Tell me if you've heard this. Okay. So basically you turn, you're cooking a frog, right? This is not, PETA's gonna come after us. This is just an example, and I actually know this example is not true, but basically if you have a pot of boiling water and you throw the frog in, apparently the frog will jump out. So it's that big change is what signals to do something, right? So if you have the frog in the water and you slightly turn up the temperature over and over and over again, you're able to cook the frog.
Okay.
Does that make sense?
It does make sense.
Okay, so it's a slow progression. Your brain has time to regulate those receptors and those hormones, right? So if you slowly change the level of your progesterone from pre-pregnancy during all the way up to the high levels of pregnancy, you have time to regulate in there.
And we're talking about normal healthy brains have time to regulate. So sometimes there's a certain subset of women that are particularly sensitive to hormone changes, and so even that change, even that slow change, can create a recipe for mental illness showing up. But I think in a normal healthy brain, we're able to adapt to that. And in a normal healthy brain, when we take away all those hormones, it's normal to have like this emotional dysregulation. That's why tons of people, like 90-80% of women have the baby blues.
Yeah.
Because there's just a huge adjustment going on.
Or like, just the adjustment period from little changes here and there to this big change in the postpartum period. That's where the problem can be. So do you test your hormone levels?
Yeah, so testing hormone levels is actually really not effective in the postpartum period because it's normal that your hormone levels are not normal in that time.
Right, and even if you had a level that was considered normal, your brain is like, oh wait, this is a huge change, we need to regulate to it. So it's more about the difference than what the actual hormone level is.
But basically, testing hormone levels isn't going to tell you if your hormones are off and if that's why you're experiencing depression or anxiety. It's more just that, like Dr. Haynes is saying, change in hormone levels that's affecting people's brains. And it's not everyone who gets mental illness in relation to that hormone shift. It's a certain subset of women that are particularly sensitive to that. And it's also not just the hormone change, right? Mental illness usually doesn't occur from just one thing. It's usually kind of this combination of things that are going on in that person's life at that time. And we see that hormones play a pretty big role in that.
Right, I mean, lack of sleep in and of itself can be enough to like make people feel bad, which is why we recommend that you prioritize your sleep. Watch the sleep hygiene video, that's a good one.
Yeah.
I like that video.
Me too.
Okay, so testing your hormones, probably not going to help give you answers about what's going on.
Yeah, and taking hormones postpartum to treat postpartum mental illness also has pretty much no evidence for being effective unless you're talking about brexanolone or using like a super high dose medication of progesterone, which you have to like go into a facility and get that done because it's so high dose it can sometimes make people pass out.
There's much more safety information and evidence of benefit for other things.
Yeah, and that's a good point, isn't taking supplemental hormones, especially postpartum or when you're in kind of this very delicate time of hormone changes, can potentially have risks and side effects. And so it's really important to know what are those risks and side effects before you take those hormones.
So probably not. Talk to your doctor, of course, but hopefully this information is helpful for you to have an informed way of approaching the conversation and situation.
Yeah.
Thank you for being here today. We're so happy to have you here. Please subscribe to our channel, videos every Friday, and comment, subscribe, share with your friends. We'll see you soon.
Bye.